Hey friend, welcome to Grounded, the Vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and/or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Hello and welcome back to Grounded. This week's win is from Emma. Emma says, I just wanted to take a moment and jump on here. I've had a complete turnaround lately. Everyday sensations are disappearing one by one, and I'm not really having any symptoms. It just literally started fading away. Maybe the meds have kicked in, maybe my consistency is paying off, question mark. Whatever it is, I'm thankful for what I've learned here. It gets better, everyone. For those who need to hear this, ask me anything. If you like, I love you all. I said, congratulations. And she goes, I'm back to working full time, which I never thought would be possible. Able to do things after work, able to eat and move how I want. It's just amazing. Every moment I feel normal, I take a moment to embrace it. I love that. Then a woman named Wendy in group asked, what are the main things you're doing? She goes, hey, looking back, it's been a long road. I'm consistently taking supplements, doing about 5 to 10-kilometer walks 3 to 4 times a week, taking my meds, positive mindset, and eating well. I just have days where I wake up and say, you don't have to feel dizzy. And if I have sensations, I don't react in a negative way. This is something huge that we preach in Vestibular Group Fit. I think the meds also help with that. I don't know what's changed, but I'm not mad about it. I love that she didn't do one specific distinct thing here because it usually isn't one specific distinct thing. It's usually over time, you start to get better and better about doing the things consistently. You figure out what works for you. You realize, oh, this medication works better than that one. This supplement works for me and this doesn't. This movement routine works for me. This one doesn't. Changing my mindset always helps. When I eat well and balance my blood sugar, that also helps. All of these things combined, right? It is never, and I mean never, just one thing. And I know that everyone wants it to be this big, sexy thing that it's just this one thing that I can do, this one pill I can take, this one supplement I can change, whatever, but it just doesn't exist. It is not a thing. And today we are going to specifically review the things to do if you have a vestibular disorder in this episode, which is why I wanted to start with that win today, because it is a huge one. It is a big deal. These things do get better. She has vestibular migraine and triple PD. And again, it does get better. It does change. You do grow. You do experiment with things. And then you're like, oh, this does get better. It always does. Always, always, always. And I promise you, there are things that you can do differently and likely better that will also be helpful for you. But it is not just one thing. And I really wish that it was. I really do. I would be a really rich woman if I could be like, this one thing is going to help your vestibular disorder. It just doesn't. But I can tell you a specific group of things that you need to do consistently and slowly bring into your life that absolutely do work. So let's get started. Hello and welcome back. All right, let's dive into the episode. There are a lot of things to talk about, but today I really wanted to give you an overview of why I do the things that I do in practice. And I know that in other podcasts, I've talked about things like how we manage vestibular migraine and triple PD and all of these other things. But what I really want to talk about today is why I do the things I do in practice, in vestibular group fit, in all of the things. And you can either work with me, you can not work with me, you can bring this to another provider. But these are the things that both science as well as myself have found to work best in the management of chronic illness and especially vestibular disorders, especially migraine and vestibular migraine. Now, of course, there are a lot of things to consider, but I really want to break it down to what I have coined as the oak method. You guys have probably heard me talk about this before, whether or not you knew what it was called, but the concepts of movement, mindset, having a supportive community, and being educated about your disorder. So I came up with this after years of practice, and I can actually pinpoint the day that I shifted from prescribing everyone the same head shaking exercises for chronic dizziness to the day I said, I need to take a step back and look at all of my patients, all of my clients, everyone who I've ever seen with dizziness as a whole person and not just as a person with a hypofunction or a person with vestibular migraine or whatever. This approach gives you the capacity and gives me the capacity to look at you as a whole person. You are not a vestibular disorder. Your vestibular disorder is probably the least interesting thing about you, right? I always say this, your health is the least interesting thing about you. And it's important to know that because your health is not something that needs to be discussed at the dinner table if you don't want to. It's not something that should be a topic of conversation if you don't want it to be. Your health is your health, but also it is not just the health of your vestibular system that we're looking at here. It is not just the health of your brain that we're looking at. We want to look at the health of you as a person. How's your blood sugar? How is your sleep schedule? How is your stress hygiene? How's your stress management? Do you have kids and that is providing a lot of stress because maybe you're not living in a really supportive environment? Maybe your boss is really toxic and you don't work in a supportive work environment and that really put you over the edge. Maybe you recently lost a parent. I've heard it all. And these stressful situations and management of that and caring for yourself before you care for other people is really, really important. So when we talk about the oak method, that's what I mean. I mean a holistic, full body approach to managing your vestibular disorder. Now, again, this is important because if you do not manage this from a whole body approach, there are not enough medications and supplements in the world to help you manage a vestibular disorder. And this is oftentimes a hard pill to swallow, no pun intended, because there are lifestyle changes that you are going to have to do. There are going to be changes to your life, to saying no to some things, to all of these different things that you are, again, going to have to do, even if it doesn't sound like the most fun thing in the world because of your vestibular disorder. Now, I'm going to tell you a story of the day that I realized this. I had this patient, we will call her Jane, and that's clearly not her name, but I remember her so, so clearly. She was the first patient who ever came to me and said, Hey, you are a person who treats vestibular disorders, and I am pretty sure that I have vestibular migraine. And I looked at her and I said, Okay, great. Vestibular disorder, vestibular migraine. It's a vestibular disorder. I know what to do. It was the first time she'd ever been to a physical therapist for this. She had developed it post-COVID. It was in 2020. And I gave her VOR times one, VOR cancellation, and some balance exercises. She was crying in my office. And we talked. We had a really great conversation. We decided to continue to see each other over telehealth so she didn't have to take the train to come see me in New York. Sounded like a good plan. And week after week of giving her these head shaking exercises, I was like, this is not going the way that I would expect it to go. She's getting better at the exercises, but she's not necessarily less dizzy. And that really sparked something for me. And while I was seeing Jane, other patients started coming in with the same diagnosis. And I started to see more and more of them with chronic dizziness. And I was like, okay, all of you need to go home because clearly this isn't working. And I am determined. I am a person who, once I set my mind to something, I am absolutely positively going to figure it out come hell or high water. So I dove into the research. I figured out what migraine was. I figured out what vestibular migraine was. I learned more about triple PD, which I knew what it was, but I didn't really know what to do about it. And I'm a person who graduated from PT school with a lot of vestibular experience just because of where I did my clinical internships, more than most physical therapists have in their lifetime, just from that internship, truly. But I still didn't know enough. And this is where it's so important to see someone who actually knows what they're talking about. And just being certified in the thing is not enough. Like I'm certified in pelvic health, but I, in no sense of the word, should be using my pelvic health certificate because I don't do it on a regular basis. So unless your physical therapist is regularly treating chronic dizziness, they are not the physical therapist for you. So back to my story. I sent them all home. I did research over a couple weeks and I put them on my schedule for like the next month or whatever. And I continued with my regular caseload of orthopedic patients who were getting better, and that was great. And I was just thinking and thinking and thinking. And I realized there was one patient I had who was getting a lot better, and she was eating a really well-rounded diet. She was meditating on a regular basis. She had a really supportive partner. She had a lot of things going for her that she had changed in her life. She had had an incredibly stressful job in New York City where she never slept, she never exercised, she didn't eat well, she had processed bagels or whatever sandwiches from the bodega down the street, which once in a while is okay, but it's not an everyday thing. And I looked at her and I said, I wonder if I implement what she's doing into my other patients, the Janes of the world, if it would work. And it worked. And then after that, true story, my boss realized I was really good at this. And he was great. He was the greatest first boss who rocked. Started letting patients drive me out to the Hamptons on Saturday mornings, and I would see them in their home. And I was like, people cannot afford this. This is crazy. Some people can in New York, fair, whatever. And someone literally would pick me up outside my New York City apartment at 6 a.m. on Saturday morning. I remember I did this before my now cousin's wedding. And like Dee's cousin's wedding. Someone picked me up at 6 in the morning. I was like, I have to be back by 2 to get ready for this wedding. I went to their house, evaluated them for BPPV, vestibular neuritis, and vestibular migraine, gave them a plan of care, and went home. And I was like, I am perfectly happy serving the people who can afford to literally drive me to their house or come see me at an out of network clinic or whatever. But also, there are not enough vestibular resources in the world for people with chronic dizziness because with chronic dizziness comes chronic management. So I thought to myself, I am going to start an Instagram account that is only for my patients to see because a lot of them would be like, hey, I forgot what we talked about last time. Can you like make me a write-up or a handout or something? And I was like, I'm just going to post it on Instagram, whatever you needed to know today, and I'll just send you that post. And they're like, okay, that works. Clearly, the 10 people that I made that Instagram for are now at 40,000, which is wild to me. And I'm so grateful for it. But that's how I came up with the Oak method and with vestibular group fit because I realized, hey, the people who are getting better are the people who have access to education of what's going on in their body, the resources to support themselves to do so, the ability to move their body again and strength train. Truly, the people who were going to the gym or strength training in their home or whatever were getting better faster. And the people who shifted their mindset from this is happening to me to the world is happening for me, or I know what to do, or I'm going to take all of this and take a lesson from it, or I am going to form a new, better relationship with my symptoms. Those people were also getting better faster. And I said, okay, well, if I can just do those 4 things really well, maybe people will get better faster and I'm going to put it out into the world. And there was vestibular group fit. So I want to tell you exactly what is in the Oak method. This is a free open resource to you so you can learn exactly what to do if you are in need of help with this. This week is the Black Friday sale for Vestibular Group Fit. That is something that you should know as well. The code is just Black Friday at checkout. 30% off 6-month memberships, 25% off 3-month memberships for your first subscription cycle. But regardless, here is what to know about the Oak method. It is a holistic, science-backed approach to managing vestibular disorders, and the goal of it is to empower you to take control of your symptoms and improve the quality of your life. It focuses, again, on those 4 main key pillars: movement, mindset, community support, and education. This is so effective for treating vestibular disorders because it impacts your mental health, your daily functioning, your ability to move confidently, your ability to say no, set boundaries, and know what it is that is going on in your body. There is research to back every single one of these pillars. So, pillar 1 is movement. Movement is at the heart of vestibular rehab, as we know, but it is also at the heart of every single human being's living's requirement. Your brain and vestibular system, of course, are trained to be used better by head shaking exercises and things like that. But those exercises, although they technically do help you adapt your vestibular system to the rest of your body, they don't necessarily help you manage something like vestibular migraine, because vestibular migraine is a whole body condition, specifically a neurological condition, but it affects your entire body, not a peripheral vestibular disorder condition. So there is a lot of science that has gone into this. There is science to say that exercise and movement in general will prevent migraine attacks, which is obviously phenomenal, what we're going for at the end of the day. In a review of literature, the addition of exercise to traditional preventative regimen may improve added benefit. Low physical activity levels are associated with higher prevalence and frequency of migraine and other head pain. So migraine, again, vestibular migraine is a subset of migraine. It's not just head pain that we're looking at here. We're looking at migraine as a whole. Strength training exercise regimens demonstrated the highest efficacy in reducing migraine burden, followed by high intensity aerobic exercise. I will link these studies below. Again, strength training, super, super important. Tai Chi is another class that we offer. Tai Chi and vestibular rehab improve vestibulopathic gait via different neuromuscular mechanisms, which is a study. So the Tai Chi group versus the non-Tai Chi group exhibited a positive relationship in energy expenditures and change in trunk velocity peak and range. So basically your balance and your ability to be stable and how you walk is affected positively by Tai Chi. It also is fall prevention and balance improvement. Yoga is another excellent way to move your body, and it appears to be associated with moderate improvements in cognitive function. So if you have brain fog, yoga can be amazing. And compared with a control group, yoga therapy is associated with remarkable decreased pain intensity, headache frequency, and headache duration. Again, we can kind of replace headache with attack in these situations. Pilates, also fantastic. Pilates will help strengthen deep muscles as well as show improved muscle mass in your trunk. And trunk stability is actually one of the things that we need to consider when treating triple PD. Dance, ballroom, ballet, all of the things are absolutely phenomenal for this because there are alterations in improved cognitive function like memory, attention, body balance, and psychosocial parameters. So if you're, again, having brain fog, difficulty with word finding, things like that, dance class can be an awesome option. There are so many amazing studies that, again, go with cardio, strength, Tai Chi, Pilates, yoga, dance, you name it, to improve and prevent migraine attacks, vestibular migraine, and help you with triple PD. So whether you're struggling with vestibular migraine or triple PD, movement and strengthening your body in the right way, not just going to run a 5K off the couch or trying to complete a 45-minute in-person strength training class or trying to lift really heavy weights in your own home even, isn't going to work unless you do it the right way. You have to scale properly. You have to let your body adjust. You need to, again, figure out the way that it works for your body in order to get there. The next thing that we focus on in this method is mindset. So the dizzy, anxious, dizzy cycle is so incredibly prevalent. I cannot stress this to you enough. There's clinical evidence and clinical practice demonstrating that many patients with vestibular peripheral vertigo have also depression and anxiety. The coexistence of these disorders could lead to a vicious cycle and have serious effect on the treatment and efficacy and quality of life. So anxiety and depression are correlated with different types of dizziness and vertigo. Treating the anxiety and depression also improves outcomes of dizziness and vertigo. Additionally, when trying to treat migraine, controlling worry and the ability to relax are actually two things that will improve your migraine outcomes. And vestibular disorders, as we know, can trigger or cause anxiety to happen because of active areas in your brain. And so both reducing the dizziness as well as reducing the anxiety. Some people have to start at one place, other people can start at different places, right? Some people can start with the anxiety, some people have to start with the dizziness. It depends on the person. It's so incredibly personal. And the cognitive behavioral principles in managing chronic disease through thinking, through reprocessing memories, through reprocessing the way that you behave and your thoughts based on your emotions, which we cannot control, will have a positive impact on your outcomes with chronic symptoms. Ability to manage stress, reduce stress, the ability to improve autonomic function. There's also some studies that show that yoga nidra are associated with positive psychological changes and blood glucose levels, red blood cell counts, and hormone status. So doing these things to relax your body, reduce the amount of cortisol, figure out what's going on inside your body will have a positive and distinct impact on how your vestibular disorder feels. And that's why the next pillar is always going to be mindset. I even tell people often to think about mindset first before trying to do anything else, because if your body does not feel like it's safe, you will not be able to properly do vestibular rehab or try and retrain your brain or anything like that, because a body that's stuck in fight or flight usually isn't able to figure out how to get to a place of security, safety, and therefore change. Next is support and connection through community. Your community matters. Whether it is a supportive online Facebook community, I know that there are a lot of negative ones. I am very intentional about making sure ours is positive, but the impact and experiences in a community support group can be really, really beneficial. And there are studies to show that a support group, coaching calls for education, as well as understanding from other people and figuring out like what is going on in my body, all show direct correlations of properly and better management of chronic illness, which is exactly what I want for you. And last but not least is education, right? I feel so passionate about the very unexciting topic of educating you on your vestibular disorder. We want to educate you because knowledge is power. It's not exciting. It's not fun Saturday night to be like, I'm going to watch videos on how my vestibular disorder is working in my body so I can figure it out. But there are studies, again, to show that there is improved patient satisfaction with health literacy, as well as improved patient care and shared decision making by healthcare providers when the patient understands their disorder. And there are almost no medical doctor providers, PAs, NPs on this planet that are going to sit with you for an hour and a half and determine exactly how to describe to you what's going on when you have a chronic dizziness disorder. There's just not the time in the healthcare system that we have. It doesn't exist. So finding a different way to educate yourself on what is triple PD, what is vestibular migraine, what is vestibular neuritis, all of those things is the way to go about this. It is really important because, again, when you're preparing for a visit, let's say, you want to know and understand that, hey, I know what's going on in my body so I can talk to my doctor about it. Ashley, a vestibular group fit member, said, I just wanted to thank this group and Dr. Madison and Dr. Jenna for all the amazing tools, podcasts, courses, etc. You guys changed my summer and helped me so much. Today I had my first appointment with my neurologist, my new neurologist, and I had all the tools and knowledge I needed. Thanks to y'all. We came up with a good plan I feel comfortable and confident with. He feels like this is the last piece of my missing puzzle. I feel so hopeful. Also, I realized this morning that I've been dealing with triple PD after listening to this content, so perfect timing for my appointment. Thank you guys again. You are changing lives daily. So again, it's important to understand what's going on in your body in order to talk with your doctor. So if you're like, "Oh, I'm just going to go down the Google rabbit hole," I don't recommend it, because most of the time either your doctor doesn't know enough about this to help you, or you're not going to be able to know why that they're prescribing a certain medicine, but then you're not going to be able to ask because there's not enough time. So having an outside resource to help educate you is everything when it comes to managing a vestibular disorder. Someone wrote me an email recently that said, "Additional info. I have gotten so much for this program." This is Mark. "I have gotten so much from this program and I have learned so much. I can hardly believe I am able to write this email to you. A year and a half ago, I could not get on any device, watch TV, drive a car. Now I can do almost all things in moderation with my Avalux glasses for migraine and light issues. I figured out my food sensitivity and now I am thriving. I could not have dreamed that I am where I am today. The constant positive reinforcement and input, as well as the material, was so needed for all warriors. I cannot thank you enough. Best reward was my trip to Hawaii visiting my daughter recently. I was able to swim, snorkel, hike, sail. Absolutely unbelievable. An impossible dream 5 years ago. Next stop is Italy with all the tools in my tool belt that you have given and taught me. Hugs and kisses to a best friend that I have never met and her team. I'm so grateful for you all and your staff of supporters." Okay. I love this, not because like, "Oh, I helped someone," which I obviously love. But the point of that reading you that email is not to say, "Hey, this is the only way to manage this," but it is to tell you that vestibular disorders are manageable if you have the right resources, when you have the right resources, when you figure out the tools in your toolkit that work for you and your body. You feel better. And that's why a holistic approach is so incredibly important. It requires a multifaceted approach. It is not just let me go to the doctor and figure out the next prescription for me to take. It is about managing your stress, having a supportive community, understanding your disorder, figuring out how to move your body again, how to strength train, because it is required. Moving your body is required. There's no way around it. Changing your mindset to break the dizzy, anxious, dizzy cycle so that if dizziness does come up, you don't ask yourself, "Why did this happen? Why me? What did I do wrong?" You instead tell yourself, "Hey, today my bucket overflowed a little bit. It's okay. And here's what I'm going to do about it." Because lacking tools in your tool belt makes managing vestibular disorder nearly impossible. And your tool belt should not just be a triptan, a Nurtec, and a nortriptyline. Those can be really helpful for you, but it's also breathing, a specific weighted blanket. It is also grounding. It is also mindset. It is also supplements. It is also getting outside. It is gently moving your body. It is stretching. It is massaging your neck. It's different essential oils, and it's all trial and error until you figure out what it is that works for you. It works. Using these pillars works. And I have had people, this is really bad for business, but I'm going to tell you, I have had people tell me that they listen to this podcast completely for free. I make almost no money from this podcast, you guys. And they have figured out every tool they need in order to thrive, and they're on their way to Italy or on their way to France or whatever. I'll try and find the email if I can. Just from this podcast. Again, they never joined group. So use these pillars, use the things. And if you need extra help, I am here for you. Is this vestibular rehab? No, it is not the same. Vestibular rehab is going to be a physical therapist in their office. I love a physical therapist. Do not get me wrong. I am one. I am trained in vestibular rehab. I get it. Vestibular rehab is about you shaking your head around. There's going to be probably some lifestyle changes for sure, but it's not going to be as comprehensive as you probably need. Is it just a workout? No. There is a workout part of this. There is an exercise part of this, but it is not just about exercise. This is about so much more than exercise. This is about a whole body This is about a whole body approach to managing your vestibular disorder. It is about, again, moving your body, yes, but also shifting your mindset, figuring out how to sleep better, balancing your blood sugar, changing your mindset, regulating your nervous system over and over and over and over again until you're like, hey, I have a handle on this. And then the last question I always get is this a brain retraining program? I could teach you to play piano, and that would be a brain retraining program. I could teach you how to do a cartwheel. That's a brain retraining program. There's nothing on this planet that isn't a brain retraining program, and that is a scammy thing that people use to sell you stuff. So yes, technically, I am helping you retrain your brain, but it's not just about that. It's not just about the neuroplasticity of retraining your brain. It's about how to manage your life with vestibular disorder. And it's not just how do I live with dizziness? Because for some people, that might be the case. But for most people, it's how do I not be dizzy on most days? And that is a goal. But we're going to start with functional goals. We're going to start with the wheel of management. We're going to start with, hey, what are the things that I really do well? And what are the things that I could work on? Which of the basics am I going to try first? Maybe it's mindset, maybe it's a breathing schedule, maybe it's eating more protein in the morning. And I don't recommend doing these things all at once because doing everything all at once is overwhelming. Do it slowly but surely. Take what you need. And remember, the Oak Method is here for you in Vestibular Group Fit or on this podcast, wherever you need it. Take control of your vestibular disorder today and start your journey to healing. This gets better, you guys. I have tons of evidence of this getting better all over this podcast. There's an episode last week with Danny where she talked about this. There are other episodes all year with Rose and Jerry and Sarah about this getting better. And everyone has a little bit of a different thing that helped them. It's not just a medication. It's not just an elimination diet. It's not just breathing and grounding. It is a combination of all of the things that work, that are science backed and comprehensive and holistic in order to get you to where you want to go. Take medications or don't take medications. Go to the neurologist or ditch your neurologist. Whatever works for you and your body is what I want you to do best. Because at the end of the day, this is your journey. This is your health, and you should get to make the decisions. Again, last but not least, the code. Remember, you guys, the code for a 6-month subscription, 30% off, is Black Friday 30. And 25% off a 3-month subscription is Black Friday 25. I love you, and I'll see you next time on Grounded. Thanks so much for listening. If you liked this episode, head to the show notes and take the free vestibular migraine and persistent postural perceptual dizziness masterclasses. If you're interested in undoing your chronic dizziness and feeling better faster, join us in Vestibular Group Fit using code GROUNDED, all caps, for 15% off. Find me on Instagram at the Vertigo Doctor and Dr. Jenna at dizzy.rehab.therapist. Your success story begins today. Dizziness doesn't have to be forever, so let's get you the right tools to thrive. Remember, rate, review, and subscribe to this channel wherever you are listening so we can keep getting great guests and reaching new vestibular warriors. Love ya, and see you next time on Grounded.